Assalamu alaikum. Our pleasure to start now our session. It's women in ophthalmology. I'd like to invite Dr. Suzanne Aman to present her presentation. It will be a difference in practice and career satisfaction between male and female in Iraqi ophthalmologist.
Good afternoon, everybody. I'd like to thank the scientific committee for giving me this opportunity to participate in this prestigious session. I'm Suzanne from Iraq. My talk will be obstacles and challenges facing women ophthalmologists. To start with, why we choose ophthalmology. Ophthalmology, as one of the specialties that is attractive to medical students, as perceived to have a favorable lifestyle profile. And a study of a graduating medical student showing that a study of a graduating medical student revealed that an average career choice were equally guided by lifestyle and future income potential. Another study of factor important to resident by gender revealed that in women, lifestyle are much important than future income. A study published in Medscape 2018 survey on lifestyle and burnout revealed that ophthalmologists are one of the happiest specialties with the least burnout and depression. Here we have some positive trend. Women compose approximately a quarter of ophthalmology workforce and nearly half of ophthalmology residents. American Board of Ophthalmology, for those who attained examination from 2005 till 2014, women represent 37% of the candidates for examination. There is increase in number of women presenting in conferences, publishing articles, and working in academic centers. We have a true pioneer, 19th century women who preached the ophthalmology glass ceiling. The first American women who takes specialized training in ophthalmology were Isabel Hayes and Elizabeth Sargent. We have certain facts that highlight underrepresentation of women. Women ophthalmologists are authoring publication in increasing number that match their prevalence in academic work, but however, all editors are men. This is a study published in 2012, involved a survey in 3 important journals. Women receive about 25% of major ophthalmic society awards. The study from 1972 till 2020, the award mainly are research-related awards. Still, we have underrepresentation in achievement or service society award. Some medical society are more gender balanced, but all highlight necessity for gender effort to achieve equal women representation. Here we have barriers that are specific to female ophthalmologists. There is a unique challenge worldwide for a woman to achieve balance between home life and their work life. Maternity leave, child illnesses, and family responsibility. Again, during COVID era, children teaching, all of them are barrier for women. Women are unable to devote themselves completely to work. I think you are agree with me totally regarding this point. We have a fewer mentors in the field of young ophthalmology, young female ophthalmologists. Again, we have some unpleasant facts. Female residents perform fewer cataract operation and fewer total procedure compared to their male counterpart. A study published in JAMA Ophthalmology at 2019, and this is the result of the study. A finding requires further exploration to ensure that residents have equivalent surgical training regardless of the gender. And from here, we request for the board committee about frequent assessment to exclude gender disparity in training. And here there is some encouraging point. Patients that are treated by a female doctor, in spite of their have the same surgical outcome, but they have less mortality rate if they are treated by women surgeon. This is not related to ophthalmology alone, but to the surgical branches in general. For those who are treated by female surgeon, they have a fewer mortality rate. Why this is? This is because the female doctor are more likely to use a patient-centered approach, and they are follow evidence-based guidelines. In general, and you agree with me that women perform longer consultation, more counseling time. We spend a lot of time by taking history from the patients, and in any medical specialty, women physicians are able to bring different perspective to care. Our mission: we continue to bring attention to and action toward women underrepresentation in award and leadership role necessary to increase equity awareness in training chances and avoid and provide action like mentorship for a young ophthalmologist. I will shift to a study that I recently tried to publish in a high standard journal. This study, a Google-based questionnaire, has released in our social media that include 500 ophthalmologists in our group, a survey including 3 domains: demographic characteristic, career satisfaction, and clinical practice. And our result, in summary, we have overall satisfaction, male and female. Overall satisfaction, 66% with their ophthalmology. And the women represent about 34% of the responder. Satisfaction reported significantly more in male gender and older age group, and those who work more than 5 hours per day, who have more than one operation day per week, and those who have a private clinic. Although women year of practice were not different from the male, but women working hours, days, and operation days were significantly lower. Women have less chance to getting subspecialty and private clinic. They are having less opportunity to do diversity of operations in correlation to the to men counterpart. And the causes of why they are not satisfied, their answer, hard responsibility were the major reason for their not satisfaction. This is in both gender, whether male or female. Obstacle that preventing the ophthalmologist from gaining subspecialty, the answer for the female was the family responsibility. Mainly, the family responsibility was the main obstacle for the female to attending subspecialty, while for the male, the private clinic is the obstacle for achieving subspecialty. Regarding their approaches to achieve work-social balance, The answer for both of them, for both gender, they request family help. But to me, the concept of family help here is different regarding the male and women. For the women, take family request from their mother-in-law, while for the male, they take the request from their wife. Again, this is another obstacle. So in conclusion, Iraqi women ophthalmologists might facing greater obstacle to their male counterpart. They have fewer working hours and fewer surgical procedure and have less chance for getting subspecialties. My advice to young ophthalmologists, good training should be taken at least whenever it is approachable. Good training before beginning a family commitment as possible. Keep going and develop confidence. And if you can't trust your hand skill, surgical hand skill, you can progress in medical subspecialty. And try to involve your kids in your practical daily life. This is, I find, to me, is of great importance and reduce a lot of obstacles. And in conclusion, I'd like to invite you all to our upcoming Ophthalmological Society conference in Baghdad at 23rd, 24th of November 2022 in our beautiful city, Baghdad. And great thanks for your kind listening.
Thank you, Dr. Suzanne. Okay, I'd like now to invite Dr. Nancy El-Ragad. She's not there. So I will call Dr. Noura Al-Mansouri to give her talk in female leadership.
Can you present my slides, please? Thank you so much for being here until this late time of the day. And unfortunately, I can see only a few males in the session. So it's women in ophthalmology, but it's not only for women. So I would like to see more males next time in this session, please. So my talk today about leadership and women leadership in ophthalmology. My name is Dr. Noura Al-Mansouri, consultant ophthalmology vitreoretinal surgeon. So I already came in a field where there is more male predominant in this field. So I have to know and I have to get the skills how to be able to adapt and how to be able to survive among this male predominant field. So I will give you just a brief history of my previous expertise. So I was in a government, then I moved to a private sector. So in the private sector, I am now the medical director. So I'm the only female there, and I'm medical director of all males, and I'm the youngest among them. So I have to be able to know how I'm going to control this group. Fortunately, when I was the resident, I was the chief resident. Then I was contributing in the program director of my, like associated program directors with my program director during residency. So I managed to grasp a little bit of them from this leadership skills. And during our medical school, during residency, you should do the effort to learn about leadership. Leadership is totally different from whatever you are doing in the clinic. So there is a management skills you need to get. First of all, starting to manage your clinic and to be able to be on time, finish on time, start on time. This is like many leadership skills. Then you will be growing up to see, to manage a bigger group as well, more complex communication. So to start, women in ophthalmology, like what previously mentioned, so the first woman to be a member of American Society of Ophthalmology, it was in 1904, and there was, as you see in this picture, there was like a whole journal published about women in ophthalmology. I know it's a very important issue because we are the minority in the field of ophthalmology, and like what you can see, women in the American, so women in ophthalmology only 20%. And 8% in the US is head of department, so it's even less being a leadership in the field of ophthalmology. So here is our Minister of Happiness in UAE. This is what she mentioned. Female leadership can change the way global solutions are forged for the more sustainable and prosperous tomorrow. So why it's important to have more females in the leadership? Women have become leaders. They provide a different set of skills. So we are thinking differently from men. We are seeing the issue in a different perspective than men. So they will have more imaginative perspectives. The second thing, this creative standpoint and unique sense of awareness, while also allow them to study and uncover finer details that may go unmissed by by men. So what are the main challenges for female in leadership? Men are still the majority. This is the first thing. Second thing is difficulty in creating supportive network. So we need this supportive network where they can give you the advices and you can share your thoughts without being afraid of sharing and open up your minds. The other thing what have been mentioned previously, it's how to manage between work and social life. That might not be easy for females, especially if you are the most responsible person to take care of the kids and to be able to manage between work and home. So expectations from women are often lower than men. And I don't know why the reason, but maybe because it's mainly male predominant field, so that's why they are seeing women more busy with taking care of kids, getting pregnant, taking maternity leave, so the expectation might be even lower from female ophthalmologists. The other thing, women are characterized by being emotional. Being emotional shouldn't be a negative feature of a woman. It should be a positive strength part of the woman. Sometimes being emotional, you can go to the level of your patient, you can provide the emotional part that patient might need from you. And I think this is a strength point. It should be taken care of a woman, not a weakness. So what are the skills as a woman you need to adapt to be able to be a leadership in the field? First of all, you should be an effective communicator. Having this skill, you will be able to deliver your points, deliver your idea in a very clear manner, so people will understand what are you going to say, and you will be able to convince others to try to understand your thoughts as well, to try to follow your points. The other skill is being trustworthy. Being trustworthy is important by all means, for male and female. The trust is a major thing that everybody should take care of it to be able to be a leadership in this field. The other thing, problem solving and critical thinking. Being a leader, it's you will have more problems and you have more issue where you have to be a critical thinking and not to be biased for any of the sides. You need to be a critical thinking as well. You have the skill of problem solving. There are so many training programs, so many books you can read to be able to enrich these skills in yourself. The other thing is the confidence. If you are not confident, you won't be able to do anything. So you have to build the confidence to be able to speak, to be able to communicate, to be able to explain yourself, and to be able as well to deliver the points. The other thing, which is, I think, important as well, emotional intelligence. So emotional intelligence is now the trend. Everybody is talking about it. That's why you need to build up these skills. Some people, they are very honored to have it by natural way, but other people, they need to know how to improve their emotional intelligence. And there are so many books where you can read how to improve your emotional intelligence. The other thing being innovative and creative. So to be leaders, I believe you should be the leader that will change in a better way, and it will increase the wherever you are working, it will increase the outcome in an innovative and creative way. By increasing your knowledge, you will be able to be innovative as well, to be updated in the recent updates, whatever, either in the leadership or in the ophthalmology fields. The last thing, or the last point, is strategic vision as well. You need to be able how to think in a strategic way by solving the issues as well, by thinking about the company from the top, not from the bottom, if you are the end user or you are the last point of the chain. So you should be thinking from up to down. Then why it's important to have more females in the leadership in ophthalmology? So the balance is really important in the ophthalmology. First of all, women leader will point the future. Second, unique transformational ideas will be brought to front. So I'm sure if you are sitting in a meeting and you have a female there, she will try to think and she will start to generate different thoughts from the other males' thoughts. So this is as well an important point. The second thing is enhancements of teamwork. Women demonstrate superior leadership values. And the other thing, business-wide communication can be enhanced, achieve a better financial outcome. And the last thing is fresh new outlook on perspective. And women leadership can provide a better mentorship. So they will be able to provide better mentorship. So there are so many benefits of having more females in the field of ophthalmology. So you should acquire the skills, then you will add a very great point to the field of ophthalmology as being a leadership. Okay, so as well you can understand here women can wear different hats, so they have more a wider perspective, they can put themselves in a different position and try to think accordingly, which is really important. Women leadership can also close gender pay gap. This is, thanks God it's not available here, but this is a major point in the United States. What they found out that women get paid less than males. So if I do the same procedure, I will get paid like maybe 60 or 50% less from the other male colleague. But I'm not sure in other countries, but fortunately here we don't have it. And this is the end of my presentation. So I would like to insist that we have to get more female leadership in the world of ophthalmology to be able to improve the quality of care and the leadership skills in the field. Thank you so much.
Thank you, Dr. Noura. And now I'd like to invite Dr. Zeynep Osterkar.
Thank you and good afternoon. First of all, I would like to thank the organizing committee for this opportunity to actually sit down with a group of female colleagues from various specialties, just to gauge in a very few frank conversation about our commitments and work-life balance in the world of ophthalmology. I would like to start by citing a very recently published article in The Lancet, quoting that gender equality is not only a matter of justice and rights, it is crucial for producing the best research and providing the best care to our patients. So gender issues are not only women issues, but community issues as well. And it is everyone's responsibility, including men as much as women, researchers, clinicians, leaders, and even medical journals. While I was searching this topic, one sentence consistently came to my attention in literature saying that despite decades of recognition, this problem is stubbornly persistent. According to a 2011 research, only 16% of journal editors were women, with not a single woman in ophthalmology. And after 10 years of research, unfortunately, it has not changed. In 2021, ophthalmology is still among the disciplines having no woman serving as editor-in-chief in the leading medical journals. When we look at the journals dedicated to glaucoma today, we as glaucoma specialists may feel appreciated that Professor Dr. Nuri Gupta raised the flag to the top of the mountain as an editor-in-chief in the Journal of Glaucoma. Again, unfortunately, in PubMed search, I could only find two scientific biographies of women, but mostly men who contributed to our field. I would like to congratulate Indian society here on behalf of Turkish society that starting from 2020 this year, they put series of articles writing about women in ophthalmology who left footprints in the world of ophthalmology. And I like their quote a lot. women in ophthalmology are meant to warm the heart and inspire the young. And an American glaucoma scientist, Dr. Theobald, was remembered in this series, who made significant contributions to the physiology and pathology of the eye in glaucoma. When we come to the academics, status of women in academic ophthalmology is still unsatisfying. And when we look at the professional rank, the gender ratios are not meant to change even today. When we take a look at the surgical procedures, these two articles put the reality on the table. Women perform fewer MIGS and cataract procedures than men, and female and male trainees are still not receiving equivalent operating experiences. In one questionnaire, although the ophthalmologists did not complain about gender equality issues, the main problem was work-life balance in this field, which would much more close the doors to the woman. Curiously, at some point in my life, I am asked the same question, especially from my friends outside medicine. How do you balance? Unsurprisingly, this balancing act is usually delegated to working mothers and rarely to fathers. And unfortunately, because of this, we have to make tremendous sacrifices, many of which go unnoticed. Women's life in stages. And there are many factors that contribute to our decisions to stay out of the club we work so hard to acquire. Pregnancy, childbearing, and few role models in front of us. And there's a threshold effect after 3 to 4 blocks here, with the last block causing the entire tower to fall. Fortunately, there are so many inspirational women in our field, and more women are taking leadership roles. It is our job to celebrate them and continue their work. And these women are extraordinary role models. I have been blessed to work with and be mentored by some of these. I owe my freedoms and my opportunity to the pioneering generation of these women. The women now in their 60s who knew that the only way to make it as a woman was to act exactly like a man. But I believe today's manifesto must change. As Mary Bird wrote in Women and Power book, you cannot easily fit women into a structure that is already coded male. You have to change the structure. In 2020, The Lancet took a fresh look at the queen bee phenomenon. The queen bee label has been applied to women in leadership positions who distance themselves from other women and maintain the statu quo. Women who reach top positions are typically under incredible pressure, and this behavior is unfortunately, the direct outcome of gender discrimination, actually. Unsurprisingly, in my opinion, empirical evidence suggests that the more secure and less criticized women feel, the more they promote other women. And a key characteristic of these women is the strength of their supportive network with each other. I think if every girl was able to find somebody to support them, and if every female professor decided that it is her job to mentor other women, I believe that the goals can be achieved much more easier. And our ophthalmology community needs to give change a chance. Role models are essential, but it's not the only part. The next part is the acceptance of different working life models. And we need to insist that social policies and career paths change to fit our choices. The traditional definition of success, which is going to the furthest in the shortest time, must change. Today's career is no longer a straight climb up the ladder, but rather a combination of climbs, lateral moves, and planned descents for women. We also need to recognize that over time, man has given women more power and encouraged them to fight their own battles. And there's a generation of young men whose mothers, us, worked full-time while they were growing up. And they know that taking care of their families means more than just earning money. I remember my father's standard reply when I produced scientific publications: "Let me know when you become a professor." My father's comment was never meant to be mean or sarcastic or condescending, but rather to be funny, supportive, and encouraging. I would like to finish my talk by referencing the inspiring words of Maya Angelou. Each time a woman stands up for herself, she stands up for all women. Thank you.
Thank you, Dr. Zainab. Actually, Dr. Nancy is not able to attend with us today, so we can watch her presentation and the video.
Hello everyone. My talk today will be about imposter syndrome and how to fight it. Where does imposter syndrome fit in our world of practice? And how does it relate to us as ophthalmologists and women ophthalmologists in particular? Actually, there are two reasons that I chose to talk about imposter syndrome in women in ophthalmology and how this affects our practice. One of the reasons is this table. This table has been obtained from a study that was published in 2018 by the Saudi Medical Journal that represents the different numbers of males and female ophthalmologists in different kinds of specialties, where the male represents the green bar and the female is the blue bar. And as you can see, that the more challenging the skill requiring practice, which is the anterior segment, the surgical retina, the oculoplastic, and the glaucoma, are dominated by men, and sometimes 3 or 4 times the number of the females or the women ophthalmologists, while women ophthalmologists prevail in pediatrics and neuro-ophthalmology, medical retina, and uveitis, and it's not covered by males, and double the number of females are undecided about their career path and subspecialty issues than compared with their male counterparts. Now, I could not find any justification for these numbers and these figures except for the imposter syndrome and imposterism, so I chose to talk about this. And the second reason that I chose to talk about imposter syndrome, it's about a story that happened to me. Once upon a time, a colleague consulted me about a cornea case, and he's older than I am. And in the operating theater, he sat next to me, and then he was watching me work doing the surgery, and then he uttered something. He said, "This is the first time I see a skilled female surgeon." Now, actually, I paused for a few seconds thinking, should I feel flattered as a surgeon or disadvantaged as a woman? And I was like bewildered by the reaction I should give, and I was like, but at that moment, reality struck me, really. And I went back in time to my residency application, the days as a female resident. When I applied for residency, I was against 12 of my male colleagues, and they resisted a female going that year to applying for residency. They wanted a male, and they kept me to the last minute to apply for the interview, and then I got the highest mark and got enrolled. And because I was engaged and married and building a family, that was a stigmata, and I was prejudged just because I had a family that I would not continue my residency years. So how come bias was all around us and we never noticed it? And is this what's causing the leaky pipeline? That where did all the great women ophthalmologists that we run into as brilliant residents, they go as we climb up the career ladder? And why aren't we selling our capabilities and seeing more women ophthalmologists in leading positions and more under the spotlight? So that's the core of the problem, according to me, and this is why I'm offering to talk about this. Imposter, or simply doubting the self-worth and accomplishments and capabilities, despite the evidence that contradicts that. It's about doubting the self privately, thinking you're alone in this and thinking this way, but no one dares to voice it loudly. Now, the problem with imposterism or suspecting self-doubt is that it buds in two directions. It makes you work twice the effort, and it restrains you and refrains you from presenting your full potential, such as taking up leading positions or sharing great ideas. The question is, why do women act out imposter syndrome more than fellow men, although that it affects 70% of all people of all genders, but is more common and more severe in women? The concept of imposter syndrome originated in 1978, where a study identified this and was labeled the imposter phenomena in women. So not only it occurs more in women than men, it also was first identified in women. A lot of factors play a role in this regard. The social and cultural preconceptions maybe, and the personality that takes the blame and the doubt onto themselves. A lot of famous people suffered from imposterism across history, including Albert Einstein and Maya Angelou, and a lot of other famous people. Now, Dr. Susan Coven, who's a general practitioner, a GP, she published an article in the New England Journal of Medicine called Letter to a Young Female Physician. She wrote a letter to her young self and also addresses all young female doctors who doubt themselves and capabilities, and this restrains their advancement and career. One of the quotes that says, "I believe that women's fear of fraudulence is similar to men's, but with an added feature. Not only do we tend to persevere over our inadequacies, we also often denigrate our strengths." And this is a very important thing. We stress over our inadequacies and stress them out to make them obvious, as if we are not worthy of success, and we devalue our own strengths by not stressing on them. Now, what feeds into self-doubt? I would not like to call imposter syndrome, because now it is, I don't want to repeat the word imposterism, because imposter syndrome has been linked to a psychological problem, and it has been linked to women in particular, and it has been linked only to coaching and life advancement when it comes to women issues. So I would like to talk about self-doubt. Now, what feeds into this? Internalized unconscious gender bias. The language that we use, the career choices that we do, and the stereotypes that we see. Lack of physical presentation of role models in the field. Preconceptions, like women are not good leaders because they're too emotional, or women are not good at maths or science, or people of color are lazy, unintelligent, or lack integrity. These are preconceptions that are away from reality. The traditional focus on female beauty make an impact on self-doubt if it implies your worth parallels your looks, not your capabilities and skills, and this is a very important point. The social and cultural stereotyping of pressing towards family over career without offering a balanced model. And we don't see this happening when you stereotype a successful or leading male physician, but family comes and points out when it comes to a female physician, as if success is not seen as a necessity for a female. There have been shades of imposterism that share mixing and matching factors between them. There are the perfectionist who wants everything to be as perfect as possible, the superwoman who takes everything on her back, the natural genius that judges himself or herself based on the IQ, the soloist that does not accept any help, and the expert who believes or she believes that she needs to know everything before applying for anything. And these are extremes of that put you under stress of imposter syndrome. The personal traits are present in every one of us in different degrees, but when we talk about imposters, they are exaggerated, so they stop the person from advancement in work and career. How does imposter phenomena happen? And is this what's causing less women reaching the top of the ladder? Now, we're more likely to experience imposter if we don't see any examples of people who look like us or share our background, who are clearly succeeding in our field, according to Emily Hu. The lack of role models has a major impact in making people feel like they do belong in these leading environments. Role models represent the signal of the possibility of advancement in work and how they managed. We learn from them how they managed to balance in order to. Let's look at this conference. Let's look at the Mieko. Now, between the 100 speakers, we had 23 women ophthalmologists. I'm very proud to be part of this festival of eye doctors in this conference, versus 77 are men. Ask yourself, how many female ophthalmologists are there in your country? How many of them are leaders in conferences and panelists and publishers and innovators? How to overcome this? Talk about it. Stop suffering in silence. Identify allies and advocates in the workplace who believe in you and are supportive of you professionally. Learn to reframe. If you slip, if you tumble, restart. It's not the end of the world. Restart somewhere, anywhere. We all have different starting points. But at the end, reach your goal. Remind yourself how far you have gone and how well you have done. Build self-confidence as you get to know you don't have to sacrifice your family or being a wife or a mother for your career. It's all about balance, responsibility sharing, and right timing. Don't frame yourself to men's standards. Stop waiting for others to find you. Present your worth. At the end, I'd like to end this talk with a quote from Dr. Coven's letter to her younger self. She said, "My dear young colleague, you are not a fraud. You are a flawed and unique human being with excellent training and an admirable sense of purpose. Your training and sense of purpose will serve you well. Your humanity will serve your patients even better." And my message to all of you is that rewrite your to-do list, please. Persevere, diversify, stand out, speak up, and lead, my friends. Thank you very much.
Okay, if our audience, they give us few minutes, I will excuse for them. I want to ask Dr. Shubhada, one of the leader and pioneer in India, to give a talk, a few minutes about her journey in ophthalmology.
My name is Subhadra, and I'm a vitreoretina surgeon. I was possibly the second vitreoretina surgeon in India who did a full-term vitreoretina fellowship. I wanted to be a retina surgeon right from the time I joined ophthalmology. I joined ophthalmology because I had a look at the retina. It's so beautiful, pink, hidden from view, and it's the window to the world. So the first time I saw the retina with an ophthalmoscope as a resident, I wanted to be a retina specialist. I just want to say that if you want something really from your heart, the world will conspire to give it to you. It's just testing your patience. It's testing your faith in yourself. I came from Kashmir. There was no way I was going to be a retina surgeon. I was engaged when I was 18. I was married when I was 22 in medical school because my father was very worried I'll run away with somebody. I didn't have any such ideas, but somehow he had these ideas for me. I was very much into dancing, basketball, embroidery, studies, and I had no time for boys. But somehow, because I was very active all the time, playing with boys every time, so my father had this idea. So anyway, it was a great marriage. But I was determined to be a retina surgeon, but there was no way I would be a retina surgeon. I finished my residency, and I had already a son who for 4 years was taken care of by my mother-in-law. He was there for me for 15 days only. After I gave birth to him by cesarean, I joined duty at 15 days after my cesarean. I was very energetic, very athletic, always playing. And I had to go back to Kashmir and join my job. That was 1991. And then a war broke out in Kashmir and we were thrown out. And I landed into the best retina service in the country. I didn't conspire. Somebody else conspired, but I wanted to be a retina surgeon. I thought there's no way I'll be. But fate led me to the place where the retina department was just 6 months old, and there was no retina fellowship. And the retina doctor there, the head of the department, he had a reputation for last 10 years in his old center of never having a female retina resident in his department. The day my interview had to happen, he had a backache and he was down with lumbar pain and he was out of the interview board on that particular day. And when I appeared in the interview and I said, retina, 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 my CV was very good, they selected me. After 5 days, I get a call from the head of retina department and he calls me and gives me a dressing down. Please change your department. You're not meant for retina. Women cannot do retina. He said, are you willing to cut your hair? How will you wear the indirect? It's not going to go on your bun. And you have a 4-year-old child and my department is going to go down. I was this tiny girl, very thin that time. I just stood my ground and whatever he was saying, like it was bouncing off my head. I was not even understanding what he's saying. So I was just smiling and he gave me all these things and he said, I like women, they should be in microbiology, they should be in contact lens. Why don't you make a different decision? I'm very shocked. If I was there on the interview board, I wouldn't have selected you. So can you change your department? So I just said, thank you, sir, for the welcome. I hope I'll make you change your mind about women. I'm not going anywhere. And I have a record in my retina department because he was very strict. So many boys left the department during my fellowship and thereafter. And after me, he's taken many women and not a single woman has left her fellowship. Everybody did. Under that lion, I think I'm the life of Pi. We had this lion in the department, the tiger, and we rode on that boat and we did a great job. And he's been my great fan. In 6 months, he was my fan. He saw, and I have a record. I have never taken a single day leave for my child's ill health. I arrange things, everything. I'm like a multitasker. I have a lot of resources. I took care of all the resources. My family is great. But I just want to say that if you want something and you work hard for it and you have that passion, nothing is going to stop you. You will reach the top of the world. Today, I am one of the 6 directors of L.V. Prasad Institute, a 208 center hospital, and I hold the quality department for all those 208 centers.
Thank you very much. I think this is the last session in this room, so I will ask you all if you can go to the hall 1. We will have half an hour about humor in ophthalmology. It is the last session, and it will be only in the hall 1 or hall A, whatever you want. Then we will go for lunch. Thank you very much. Thank you. Thank you.